Sir. Sir.
Honorable Secretary and DG ICMR, Professor Balram Bhagavat sir, Chairman NTF for Venous Embolism and Executive Director for the Incline Trust, Dr. N.K. Arora sir, Dr. Samiran Panda sir, our additional DG at ICMR, Dr. Vishnuvardhan Rao sir, Director NIMS, and the coordinator for the data management and analysis unit for this portal. He'll be joining us shortly. Respected heads of different divisions at ICMR headquarters, seniors, colleagues, ladies and gentlemen, a very good morning. On behalf of the BMS division, we all are gathered together for today's program in hybrid mode. Some of us are here in physical form, and experts from the NTF for VTE, and out of 16 hospital sites which are participating in this registry program, 14 are joining us through online mode, and Dr. Rakesh Yadav, from AIMS New Delhi, he is present here physically. So it's an honor and privilege for me to introduce about today's launch of logo and portal of I-RegVED, that is ICMR's National Hospital-Based Registry for Venous Thromboembolic Disorder. This is one of the part of the National Task Force that has been established at BMS Division for venous thromboembolic disorders. As the name signifies, why RegVED? RegVED is one of the oldest Vedas and has an ancient link to our history and civilization. Among one of the 4 sacred canonical texts, it describes not just the organ structures associated with the systems like Hridaya, that is the heart, Dhamini, arteries, and Shira, the veins, but also the diseases of the Raktavaha Srotas, that is the circulatory system, like including clogged arteries. They have found description in both Rig Veda and Yajur Veda. So now, after this brief background and introduction about today's program, I would like to request Dr. Navendra Chatterjee, head of the BMS division and the national coordinator for the program, to officially welcome the August gathering through his address. Please, sir.
Thank you, Dr. Hena. A very good morning to all of you who have joined here in person and through online. First of all, I would like to welcome Professor Dr. Balram Bhargav, Secretary DHR and DG ICMR, Dr. Samiran Panda, Additional DG ICMR, Dr. N.K. Arora sir, who is the chairman of our NTF for this venous thromboembolic disorder registry. I welcome all the experts of this national task force and all the PIs of the centers, and I also welcome whoever has joined us through online. Now, this we have been working hard on the chairmanship of Dr. N.K. Arora sir, and with the support of DG ICMR and additional DG ICMR, we have been working for more than a year to get this thing at this place. So we are on a platform to get rolling. And with help of this registry, we believe that we will be able to manage the venous thromboembolic disorders in a better way in coming future. So with these few words, I welcome you all again and thank you for joining us.
Thank you, sir, for the welcome address. I feel honored to invite Dr. N.K. Arora, Chairperson for the National Task Force, for his valuable remarks. Thank you, sir.
Good morning, friends. It is indeed an honor to be part of this whole process for over 1.5 years now. And I would like to particularly place my deep thanks to Professor Bhargav, who had the vision to launch this program in the midst of COVID program. And I'm associated with the vaccine dimension, and one of the vaccines which has been used very extensively in the country, Covishield. And one of the adverse events associated with that is TTS, thrombosis, thrombocytopenia syndrome. And still people are in dark what is the frequency of this and what is the mechanism, particularly in the Indian context. Because when we are looking at this issue from the national perspective, we find TTS is not a major problem. There are just limited or counted number of recipients of the vaccine who had this. There were few deaths also. But it was such a timely thing that I thought that this is what is required. And when we reviewed the literature, we find that there is practically a blank, except some few case reports. While in clinical practice, across the age spectrum, whether we start from pediatrics, going up to the end of the age spectrum, the problem is there, but issues related to VTE are very poorly understood. But it is not only India, the whole of Asia and most of the other low and middle income countries, we have very little problem. So I thought this was a leadership decision from ICMR, particularly from Professor Bhargav, who himself is a cardiologist and knows how difficult it is when people get into this kind of a trouble. And the important point is that we wanted to cover all socio-cultural geographic regions of the country. So besides the core group of experts, the institutions were identified in a manner. If you see the map, one feels very proud. Every part of the country in these 16 institutions are kind of taken care of. And they are not concentrated on 1 or 2 or 3 major metros. We know that big cities have better diagnostic facilities, but we have patients or individuals who are suffering from this. So that was another objective. And here I would like to place on record my deep appreciation and thanks to Navendu Chaudhary, Hina, and everybody else involved in this whole program. The way it was not an easy task, because there are 2 dimensions. One is clinicians were to be brought on board. The other is basic scientists. And getting the 2 working together, I think it's a very interesting task. But it has been very nicely accomplished. So once again, my congratulations to all the investigators who are on virtual mode as well as physically present. And thank you very much, sir, Dr. Bhargav, Dr. Panda, Dr. Rao, and Dr. Navendu. Thank you very much.
I would like to thank you, sir, for the valuable insight. You have been a guiding force for this program, and every scientific interaction with you is a blessing imbibed with information and motivation. Now, I would like to request Dr. Samiran Panda, sir, Additional DG ICMR, for enlightening us with the future vision and insights of the program. Please, sir. Thank you so much.
Good morning. I don't know how much clarity in the vision I'd be able to bring because I've been wearing spectacles since I was in 6th standard. Nobody believed that I was not able to see. Everybody thought that, oh, I'm up for a style, style statement. And I had to really convince that I'm not able to read things on the blackboard in the school, but that's a different story. I really liked the way the acronym I-RegVED has been formed, and we should also probably start appreciating why a network. Veda, as all of us know, is also known as Shruti. Those days, it would be written. It would be from one wise person saying things or sharing observations, be it in relation to health or social issues. So it used to get passed on from one to another through this oral tradition of sharing knowledge and wisdom. Can we afford to have that approach today? Probably not, because the amount of information which is being generated run the risk of getting lost if it does not get recorded, first of all. So that's why, although the acronym, I really loved it, and thank you, your Hina. The Hina talked about this entity of venous thromboembolism known to the human civilization since very, very old time or ancient times. So although it's known, the recorded history of it, as Dr. Arora said, or understanding of it is not that great. So that's why this particular initiative underlines the importance of it. The second point that I would like to, we all know and the acute phenomena of it, and when we or some individuals lose lives to this whole clinical entity of venous thromboembolism, then it causes concern. But there are quite a proportion which remain asymptomatic for long, and then come with the emergency situation when you don't have much time to act upon. We know if there is major surgery, if there is a prolonged recumbence period, bed rest, even cardiac failure, or these are the common phenomena which lead to. So you can always think of, oh, there is a risk. So how quickly can I discharge my patient? It's not a very good idea to remain on the bed for long. And the venous thromboembolism, mostly it is known that in the inferior extremities and even the pelvic veins, but when they get dislodged and run somewhere else and blocks the supply to the vital organs, then there's a chance of losing lives. But what happens when the venous thromboembolism exists, but there is no symptom? That's the issue. So from this particular network, which is going to get established, Professor Bhargav helped me to count the points which are there on the map, 16, I guess, correct me if I'm wrong, that would form the network. And it is very important now, if you realize that we cannot afford to have these information remaining in places, not recorded well, and not recorded following a systematic process, then we will remain far off from the real understanding. Understanding is the term that Dr. Arora used. So in order to have an in-depth understanding, we need to, first of all, not only record information, but information recording should happen following a systematic process and following a scheme. So there's a scheme we follow everywhere in different parts of India. And India is a big country, 16 centers, and I'm sure that, that the family members will increase in this network. Lastly, I'm from a village, and I had to learn this network. This is an English word. So I said network, well, network and advocacy, this is the terms which are going on. So that was in the HIV era. Then I said, what is network? So somebody was thinking that, yeah, and that actually helped me. He said, haven't you seen net, fish net? I said, yeah, I've seen it all along because I used to go to my grandmother's place. Have you not noticed that there are two different kinds of fish net? I said, such as? I knew both of them, but I did not really notice. They said, you see, on the small stream, there is a fish net placed there in the morning. In the evening, they come catch the fishes which are there. and those will be fine nets. And they are catching small fishes, and the big fish nets, which many of my family members also used to use to catch the big fishes in the pond, which is adjacent to grandmother's place. So if we think of a net, and if we think of the purpose, like if you have a guest coming to your home and you want to catch a fish, you use the nets, which are not good enough for catching small fishes. So if you really want to have in-depth understanding about venous thromboembolism, you have to also think of the network structure. So it's not probably just 16, it could go to 60 even, and the process through which we collect information, that's very important. So for any network, it is not just the geographical presence that Dr. Arora underlined, but also the purpose. And is the network serving the purpose is very, very important. I thank you all for giving me this opportunity to share my thoughts, because these days when I start talking stories, nobody listens because I talk so many stories. Professor Bhargav sometimes say, maybe we'll listen to it a little later. That happens many times. But well, I wish you all the best for this very important initiative. Just let us keep in mind that what is the purpose and are we having our net structure accordingly. Thank you.
Thank you, sir, for the interesting words. It was truly engrossing for us to hear your thoughts regarding our program. Now, I would kindly request Honorable DG, sir, to officially launch the logo and the portal for the I-RegVED. So we welcome all portal and for the I-RegVED. The RegVED is short form for the registry and venous embolic disorders, venothrombotic disorders. So this is the logo of our portal. The center heart signifies VTE. This is how the main page of the portal looks like. So we have the logo of ICMR, the portal's logo, and we have the dashboards where once we have one entry from Bangalore Medical College and Research Institute for now. This is the login page for the members. Right now we have defined 16 sites, and there is a provision of adding a new patient and list, and the baseline form for filling up the information contains 8 sections in total, with section 1 and 2 having a hospital and patients information. Section 3 and 4 will cover the medical history and diagnosis of the VTE. Section 5 and 6 respectively will be based on clinical examination and diagnostic investigation. And section 7 and 8 will have information regarding the treatment that was followed and the final outcome. And later on, as per the protocol, we'll be adding up the follow-up. Thank you, sir.
Yeah. So, we also talked about a biobank coming up, which will be useful for long term.
Yes, sir. So the epitome of healthcare research of our country, ICMR and DHR, is spearheaded by Professor Balram Bhargava, sir, a name that resonates not only within India, but spans across the globe. So we are looking forward for the inaugural address for this program. Thank you.
Thank you, Veena. Chairman of the RegVED, Dr. N.K. Arora, Director, Dr. Vishnuvardhan Rao, Dr. Samiran Panda, Dr. Nabendu Chatterjee, Dr. Hina Tabassum, the Principal Investigator, Dr. Rakesh Yadav, and the 16 centers who are embarking on this journey for setting up this registry for venous thromboembolism. First of its kind in India and the first of its kind in the region, is going to play a very, very important role. We have always realized that venous thromboembolism may be related to environmental factors,
related to food, nutrition, to diet, to genetic makeup, or high altitude, different terrains. So there are several factors which are responsible for venous thromboembolism occurring. Immobility, which we commonly see, obesity. So there are several factors which are responsible for venous thromboembolism. And up till now, we were always focusing on the arterial circulation as a nation. Now it is important to focus on the venous circulation, wherein clots forming in the legs, clots forming in the pelvic vein that's suggested, have gone into the lungs and have led to sudden death because of pulmonary thromboembolism. So that is an area which is normally we were taught that pulmonary thromboembolism is a diagnosis of suspicion. So you suspect it, and then because a setting is after a surgery, setting is after a big bone surgery, or the person is obese, or the person is immobile and has been in prolonged bed for a long time. So that is why the clot is formed in the vein, and that's gone into the lung and sudden death. The problem with India is that we do not generate our own data, and the whole world tries to impose things on us, particularly international players as well as industry. We talked about, Dr. Panda talked about a network and a net. Now, there were certain, because of venous thromboembolisms, there were certain studies in the West which had showed that filters and nets be placed in the leg so that the clot may not go up. And again, those studies, because of that, a large number of filters were sold in the country. We put them up in the leg veins, and then realized that they are not of any benefit. So technology came and went back, and no major advantage was done because we did not have our own data. So that is an important point, that we should have our own data about venous thromboembolism. And I think I would like to congratulate, put on record, a recent paper published by Dr. Viju Nair, I think last week in the Lancet, where he has talked about thrombosis in low altitude and thrombosis in high altitude, about 15,000 feet. It's an excellent paper which is published recently, 1 week back, talking about how thrombosis of people who go from low terrain going to high terrain are more prone to thrombosis. We knew about it, but it was never done in a scientific manner. And this has been demonstrated in a paper. Dr. Viju Nair is the first author, and this has been published in the Lancet last week. So these are the kind of data that we will be able to generate, and for venous thromboembolism, which has been a neglected field as such. The second point I would like to emphasize is that for treatment of venous thromboembolism, there is no standard treatment, and I would request that from the Basic Medical Division and Dr. Jaren to prepare a standard treatment workflow with the same committee members and some more members to develop a one-pager, so that could be part of the guidance for the nation, as we have got now for 100 diseases, and that is also in the National Health Mission, National Health Authority being reimbursed. I mean, why should you reimburse for a filter which is not working? So those are the kind of things which should be clearly taken, and the role of this registry is going to be very, very important, because it adds credibility, and it adds the fact that it is India-centric, what India needs. It has to be contextual for India rather than anything copied from the West and the same treatment stuff. So I think the registry business started in 1980 when the cancer registries were the first one which was made. Now we have more than 57 cancer registries available in the country. Similarly, I'm sure this registry will also expand from 16 centers to many more centers. And I think we'll bring into limelight what the problem of venous thromboembolism is, yet at the same time not create a fear in the society that venous thromboembolism and overuse of Doppler and overuse of unnecessary tests also. So that is a delicate balance that is to be created, and I think this registry will be able to collect data, systematic data, which will be of tremendous value. And I congratulate Dr. Yadav and the other members who are 16 members who, under the guidance of Dr. Arula and the PMS division, are going to be taking this forward. And I would urge them to do a regular meeting or a regular follow-up so that we are ensured that the data is being entered in a timely manner. All the best. Thank you.
Thank you, sir. The words of wisdom from your good self is rewarding in all aspects. And we are fortunate to have initiated this program under your dynamic leadership. Your tenure as our DG, especially during the challenging COVID-19, has motivated each one of us to strive and deliver beyond the capacity and expectations. Moving on to next part of the agenda. In today's world, data management is an integral part of any program. And ours, today we have Dr. Rao, Director NIMS, and the PI for the Data Management and Analysis Unit among us. I request you, sir, to give your expert views on the same. Thank you, sir.
So, good morning, Professor Balram Bhagava, DG ICMR and Secretary HR, and Professor Anika Arora, Dr. Samran Panda, and Dr. Chatterjee, and Yadav, Dr. Yadav, Professor Yadav, and dignitaries who are involved in this registry. First of all, let me thank DG ICMR for giving this opportunity. This is the third registry consecutively given to ICMR NIMS, believing ICMR and NIMS capability to manage and prepare the registries. In 2007 onwards, we have been doing the CPRI, and now one of the biggest registries, COVID clinical registry, which is been in operation and which is very successful in terms of its patient load. We have 50,000 patients so far registered, and also many registries are cross-sectional in nature, but this registry, almost 30%, that means 15,000 of patients have been followed up till today. So that is the COVID clinical registry, which is being awarded to ICMR NIMS, and thanks for that. And as far as this registry is concerned, they have given a very catchy name, I-RegVED. So as RegVED is the first of its Veda, first Veda of 4 Vedas, probably this is one of the first registries that is available in this country. I have gone through the literature. There are not many registries of this sort. Only retrospective registries are available. So therefore, I definitely believe with this registry would be a very good registry, and probably they have taken a lot of care, lot of input gone into to make this registry as a very very good registry in terms of its parameters taken, in terms of its data quality issues have been addressed. And as Hina already told, the ET registry portal is web-based data collection and analysis tool, and also each healthcare institution involved will be provided with a need to log in the credentials and password to get entry into the portal. The access control of the data entry, data monitoring, data download, and report table generation, everything will be monitored by the central committee. And as she already told, there are 8 sections. Enormous database has been they prepared to enter into this portal, and finally a dashboard is also being in place, and a snapshot of the data collected from all the hospitals on a periodic basis will be involved, and data management and analysis unit along with the coordinating unit would be involved in analysis of the clinical data, identify the trends and reporting the data. This would be responsible for the processing of the data, including the receipt, entry, verification, and filling of the information to generate data queries after the validation checks or errors and omissions identified during the data entry. It is the central data the unit will be taking care of this. Therefore, the unit has the capacity to resolve and identify the problems with the portal and data forms. I take this opportunity to also compliment the second level of scientists like Hina and Sumi. They are chasing scientists. They never leave us. They used to come every day to NIMS, and whatever the meeting we have, they disturb us and wanted to do this. And also we have with us Dr. Geeta Menon, and who is a workaholic, and she is also did not leave me anytime, even in the meeting. Sir, please come, please come. So that is the way it has worked. Very, I think I can say very madly they had worked, and I think that this registry would be definitely one of its first registry like RegVED, and would be very successful. Thank you very much, sir, for giving this opportunity.
Thank you, sir, for your encouraging words. We have our 16 principal site investigators join in hybrid mode with us. We are also fortunate to have Dr. Rakesh Yadav taking some time off his busy schedule to be physically present here. Sir, so I would like to call you on stage to give us feedback and your sites on this portal. Thank you.
Good morning, everybody. Respected DG sir, Dr. Arora sir, Dr. Panda sir, and all the senior head of the department sitting here. I need not to describe anything about VT because it's already being told that what is a need of this registry in this country. Being a cardiologist, I am supposed to treat the venous thromboembolism. But believe me, even in our setup, 50% time you miss the diagnosis. It is so forbidden and untreated medical entity in medical science, that is venous thromboembolism. Majority of the time, what we believe that the patient suddenly in CCU, everything was fine, and in the night patient died. It is, and everybody said it's a cardiac arrest. But there's a lot of data which suggests that pulmonary embolism is one of the most important cause of this type of sudden death. And it's usually missed. Just think of remote area where there's no facility to diagnose, no concept to diagnose, and even the doctors are not trained to diagnose this simple disorder, which can be, if picked early, treated early, it can save the life. So it is a very, very important registry. And if you go to the literature, you find a very little about venous thromboembolism. So I think under the, and Dr. Balram Bhargava is my teacher, so I know everything about him. He always chooses the things which nobody has chosen. So his able guidance, and I think Dr. Arora, I have several meetings as a PI I've attended, and the biggest quality of Dr. Arora is he never create a confusion. If there's a confusion in the meeting, ultimately he will sort it out. He will sort it out immediately. So as a PI, we all are very happy. If we say that it is a problem which we are going to face, he will listen, and he will give a very concluding thing that yes, it is a problem, it should be sorted out. I cannot believe it that how much meeting has been done to formulate this simple, you think it is a very simple form? No. A lot of debate has been done. It has been thought that let us try to generate good data, because initially there was thought so much big form, this PI is going to do it. Yes. Until we have a good data, we are not going to have any conclusion. The third important thing, the coordination from the ICMR. Dr. Hina and Dr. Nibendu, they are absolutely behind us to fill everything, to do all the formalities. And at present, I can say, I have chosen 13 departments from AIMS for this registry. So practically, I have chosen all the departments which have a patients of thromboembolism. And as suggested, that every data should be online data, which will help us to feed properly and to give a proper recording of this registry. Third important thing, as far as now, because we are involved in many of the projects of ICMR, I can say one thing, that now ICMR is going more PI friendly. So now, and that is true, because the hurdles which PI used to face is now minimized at present in ICMR. So all the persons love to join this registry, and as Dr. Arora is always, let's start the registry, we will expand the registry. So it is, today is a very great day that the registry is started and the web portal is there. And I think very soon we are going to start doing our registry research. Thank you very much.
Thank you, sir, for your valuable inputs. We are fortunate to have you part of the VT family. Now, we'll have 2 minutes feedback from Professor Sri Lakshmi. She is the site PI from Bangalore Medical College and Research Institute. She is joining us through the Zoom link. Good morning, madam.
Good morning, Dr. Hina. Am I audible?
Yes.
Okay. Good morning to the dignitaries on and off the stage. It's an honor to be a part of this registry, which is a project of national importance. Now, we all know thromboembolic events have been treated as a standalone cases in most centers across the country. None of us have actually ever tried to document the true disease burden. So this, the initiation of this thromboembolic registry, I personally feel, especially in this post-COVID scenario, is a right step which helps us not only understand the disease burden and its dynamics, but also probably help us to understand the etiopathogenesis. The etiopathogenesis of VTE has never been attempted in our country, though a lot of literature is available from the West. So I strongly feel going forward that this registry and ICMR will take a step in that direction where we start looking into the cause of these events. So under this registry in our center, we are already looking at the normally documented causes, protein C, protein S, antithrombin 3, homocysteine, all those. But here I want to draw the attention of the group here to the cultural practices we have. Like for example, in the postpartum period, water deprivation is a very rampant practice across our country. Women are not given water in the postpartum period. They're already in a pro-thrombotic state. And this dehydration and resulting concentration of the blood will tip the patient to throw an event. So maybe a systematic documentation of such practices in our country and maybe certain public awareness programs would probably in the long run ameliorate this program, this disease. And the next thing I want to tell is probably this project is definitely going to give some site-specific positive outcomes. Like my center, BMC, Bangalore Medical College, though it's a tertiary care center, we do not have the definitive therapy wing. We get a lot of thromboembolic cases to our center, but then we treat them symptomatically. We manage them symptomatically and we give them a referral to the higher centers or the next government hospital where definitive therapy like thrombolysis, catheter-directed therapy is available. But none of us are actually following up that patient if he's actually going to that referral center and getting the definitive therapy. So most of them don't go and they come back with a more serious complication, pulmonary embolism, etc. So maybe because of this registry and some nudge and assistance from ICMR, probably a vascular wing in centers like similar to ours, where there's a huge load, but we do not offer definitive therapy, could probably be established. I really feel honored to be part of this registry where a lot of premier institutes of this country are also the sites. And the interaction that we have had with ICMR, though it's been for a short while, 6 to 8 months, we have had a lot of interaction, especially with Dr. Hina in the course of the protocol development, and it has been very fruitful and very interactive. So I take this opportunity to thank the team there again for choosing our institute as a site for such a promising registry. And thank you for giving me an opportunity to say a few words here. Thanks again.
Thank you, madam, for the kind words and thank you for joining us. So now coming to the end of this event, I now request my colleague and the co-PI of this program, Dr. Sumit Agarwal, Scientist D, ECD Division, for vote of thanks.
Thank you. Honorable dignitaries, distinguished members of ICMR, colleagues, ladies and gentlemen. It is my privilege to propose a vote of thanks on this auspicious occasion on the behalf of BMS, who is conceptualized and drafted this portal, and ECD division, who is helping in implementing. We both, on the behalf of these division, a heartily vote of thanks to our DG sir for the heralding this important launch. Sir, you are inspiring mentorship and never-ending support to our scientific endeavors. ICMR. Shine to this glory. So all the best to the all PIs and thank you all dignitaries present here. Thank you all. Thank
Thank you. Thank you.